Welcome back to WKYT's Kentucky Newsmakers as we continue our visit with the Governor of the Commonwealth. Matt Bevin is with us today. Governor, obviously the health care scenario in the country is in limbo at this point, and certainly now that the Senate has pushed back the vote on replacing Obamacare or whatever happens there. You have applied for a Medicaid exemption in Kentucky that would allow you to have people work for their benefits and some other things. Have you heard on that at this point?
Yes, it's called an 1115 waiver. We have to apply to CMS, which is the Division of Health and Human Services that oversees Medicaid. And we have asked for an exemption, which simply means we would have the flexibility to modify the traditional rules as to how it can be applied. This would not apply to traditional Medicaid, the medically frail, the pregnant, the blind, those for whom Medicaid was originally intended. But for those that are able-bodied, working-age people like ourselves who have no dependents, it would require of them something that has historically not been required. It would be requiring either work, which many of them are doing, already accomplished, or if they're not working, choosing not to or not able to, then it requires one of two other things, either volunteering for 20 hours a week or getting training in something that will allow them to work. So simple things, the type of things that, frankly, most people paying for things expect to have to do something in exchange for something they receive. In terms of where that stands, we've just recently made a couple of requests to that, modifying what we're asking for, because we think we can get even more latitude with this administration than we could with the last one.
So does that push the time frame back?
It does, because we will now have another 30-day, we think within the week, we should have their permission to go ahead and now do a 30-day listening session. That 30-day session will allow the public to weigh in on the couple of additional tweaks that we've made. And then I would expect that probably by the middle of August, this will have been approved, and that's when we will start to see changes implemented.
Senator Rand Paul was asked a question on Network News pointing out Kentucky is one of the largest recipients of Medicaid expansion, and he said, the Senator Paul, we could pay for it if we doubled the state income tax and doubled the sales tax, but what would we do? He says in terms of this would send a signal to business that Kentucky was not business friendly if we were to go there.
Sure.
You are not for putting more resources into the Medicaid expansion.
I'm certainly not for raising people's taxes to do it either, and that's the and I know that he was being somewhat facetious. I know that Senator Paul is not a proponent of these things as well, and his point being, it's got to be paid for. There is no free lunch. Somebody has to pay for this. And so no, I'm for making it more efficient. The people who truly have need should be served. We owe it to those in our population who are unable to help themselves to be able to help them as best we can. But we've got to be mindful of the cost. And to that end, it's also not meant to be a destination. It's meant to be a temporary place for those that are able-bodied and of working age to be able to get a platform and transition them ultimately to commercial and private insurance through employment. And the real key here is to engage people, because a person who's engaged in their own health outcomes is somebody who will ultimately be healthier. Just simply providing coverage is not enough. You've got to get better health outcomes.
Let's get to this big question mark that hangs over Frankfort right now. You have looked at the pension problem from several angles. Kentucky simply owes a lot more than it has the resources at this point to pay in terms of those benefits. You've indicated you'll call a special session of the legislature later this year. You have also said that Kentucky will need more revenue in order to deal with that pension problem and fulfill its other commitments. Where are you at this point?
I mean, here's what my exact words were, not that we need more revenue, is that people should not expect a modification of our tax code to be revenue neutral. That is what I said. Now, you could parse that any number of ways, and indeed that would mean likely that you're going to potentially see some things rise, but I intend for some things to fall. When you modernize a tax code and stop exempting the hundreds and hundreds of things that we do, if we simply aligned our state tax code to that of the federal tax code, literally the same things being exempt or not only would it simplify the process, make a lot of people happier, but that alone would raise about $1.3, $1.4 billion in revenue. We have a very outdated, antiquated, detrimental tax code in this state. But to the question of pensions, which is what you asked me, we have the worst funded pension system in America. If we do not save this system, if we do not fix it, the checks will stop coming in a very few years. Not just for people that are working and hope to retire, for the people that are retired right now. KRS, The KERS system, if you are in that system, and that's where hundreds of thousands, the most Kentuckians that are retired are in that system, those checks are going to stop coming in the next 3, 4, 5 years. They're literally going to stop coming. Where is that money going to come from if we don't fix the system?
Is that, Governor, a worst case scenario that investments don't perform and that there are more retirements than we anticipate and so forth, or is that a likely scenario?
That is a highly likely. That is even making assumptions that we will get better returns than we've been getting in recent years. That plan last year, when the S&P was up 13.5%, had a 0% increase in return. And the irony is that I've been sued by our Attorney General and other people to keep the same people that created that mess in charge. They've sued me because I've restructured the quality of people there because that system has been so abused, misused. Tommy Elliott, who used to be the chair of that committee, is fortunate that he's not being charged for his negligence. I mean, quite literally, there may well ultimately be civil suits for the absolute negligence by the former trustees for that plan.
Are the structural changes to pension funding and the need for tax reform linked to the point that you can't have one without the other?
No, I mean, this is what I will tell you. I am not going to raise taxes to pay for this pension system. Not a chance. And I don't think anyone in our legislature is an advocate for that. Certainly the majority are not. There is no way, shape, or form. We need to deal with the pension system on its own. We need to find a way to pay for it out of the normal course of doing business. We do need to modernize our tax code, but I'm not doing it to raise money to pay off the pension problem.
So the special session that you have promised will be to deal with what?
Without a question, to deal with the pension problem. We also need to deal with the modernization of our tax code, and I'm not confident that doing that together with the budget session makes good sense. So I have not decided exactly the order. I've decided to some degree, I've not shared, I should say, exactly the order, but I will say this. Pension is utmost of importance, has got to be dealt with in isolation, even if it's at the same time as the tax situation.
You have asked lawmakers for proposed changes to tax exemptions. Are you hearing from them? Have they made recommendations?
There have been some, but I'll tell you this. Nobody ever likes to get rid of any kind of a loophole that exists. They don't. And so the hard decisions, I will say this real quickly. The Tax Foundation, which is a nationally recognized organization, has come in and is helping. I've given them every one of the tax studies that's been done in this state for the last 30 years, and there's a stack this high. I think every governor that's preceded me has studied this and come out with a document on it. And there's literally a stack this high of them, and nobody's implemented anything. They study it, they come up with recommendations, nobody's done anything.
And that's the challenge you face.
We're going to do it. I'll tell you, I was elected to clean this up and to clean this and a whole lot of other things. The corruption, the pension problems, the lack of labor friendliness, the tax situation, and that's exactly what we're going to do.
And the drug problem, Governor, in Kentucky is a scourge. We now know there were more than 1,400 overdose deaths last year. Our communities have the resources tremendously stressed in trying to deal with the overdoses, and of course this leads on to other crimes for people supporting the addictions. What has to be done to deal with that?
We have got to close off the funnel of addiction. I can't believe even the amount. Kentucky right now is the most restrictive state in America for the ability to get a prescription filled. You can get one, but your initial dose is only going to be 3-day supply. That's a CDC recommendation. But the amount of pushback I got, even from the medical community, I was surprised at that. I frankly wonder, why are we allowing an opioid, as highly addictive as it is, as much as we know that 85% of the people that are addicted to heroin and fentanyl, carfentanil, the people that are overdosing, all started that addiction by having abused and been addicted to prescription pills, 85+% of them. If we know that to be a fact, if 85% of all the opioids consumed in the world are consumed in the United States, if last year in Kentucky we put out 350 million pills, which is 80 pills for every man, woman, and child in this state, we know these things and we continue to do them, and we think we're going to fix the problem, we're kidding ourselves. We've got to cut off the supply of things that allow people to get addicted. So we shrink the top of the funnel because there's not enough money to fix the problem if we only provide beds and rehab and programs at the bottom end of the addiction.
You and the Attorney General don't agree on much, but do you support a lawsuit apparently he's announcing this week to investigate whether drug companies are partially responsible for hooking so many people on drugs?
What an opportunist. I have so little respect for our Attorney General. I don't mind saying that. He is a political opportunist. I mean, if I have not seen anything from him that would indicate he truly is going after this problem on the things that matter. He has a bully pulpit.
Do you support that lawsuit?
I'd have to look at it. I think it's like his lawsuits against Marathon and these others. They're just political opportunism.
He has sued you 4 times over the way you handled the mid-year budget cuts.
Is that all?
And the reorganization of several state governing boards. He says each time he's concerned about constitutional checks and balances, and you have called his motives, as you have here today, political and opportunistic. Do you think Kentuckians out there get frustrated with this whole scenario?
I do. I would imagine they do. It's remarkable to me that you've got somebody who is so uninterested in doing what's right for Kentucky and is so clearly trying to burnish his own personal record. If people don't think he's trying to angle to be governor, they're not paying attention.
Do you think people get frustrated with the static between 2 of their top elected leaders?
I respond only at times to the static that comes in my direction. Here's what I think they're frustrated by. They're frustrated by when the federal government tries to tell us who goes into the locker rooms of our classrooms, that boys can go into girls' locker rooms, that he doesn't have a problem with it, and I have to defend the state. I think when there's a methane rule or a waterways of the U.S. rule or an overtime rule or others that affect people in Kentucky, they expect the Attorney General to defend them, but they don't in this state. I do it.
Have spoken out on this travel ban by California as Attorney General, saying that the state employees from California should not travel to Kentucky. The mayors of Lexington and Louisville have now written letters out there and said that Kentucky is a welcoming place. Your stance?
It's the silliest thing I've ever heard. Again, apparently we're not the only state with a politically opportunistic Attorney General. But again, where's our Attorney General in calling out his fellow Attorney General on the absurdity of that ban? I can assure you of this. They may not want people to travel on business to Kentucky. I'm going to be traveling on business to California and sucking companies out of there to Kentucky. You can bet on that. This is an Attorney General who also is just trying to make ways for himself. They've already come up with more exceptions to that than they have. They're going to walk that thing back. It's a silly idea. It was meant to make headlines, and he was successful.
Our remaining moments with Kentucky Governor Matt Bevin on Kentucky Newsmakers in just a moment.